Dear APPNA members, Assalamu alaikum, Ramadan Mubarak. It is unbelievable that it has been just 1 month since APPNA focused on COVID-19 initiatives. Much has been achieved both here in US and Canada and in Pakistan. First, my salute to the 18,000 Pakistani American and Pakistani Canadian physicians for your steadfast commitment to treat COVID-19 patients under highly hazardous conditions. In New York, New Jersey alone, approximately 40 APPNA physicians have contracted the virus and one senior physician has passed away. He felt it was his duty to treat his suffering patients. The ultimate sacrifice. I will break today's message into 2 parts. First, a summary of APPNA COVID-19 relief efforts, then a spotlight on COVID-19 relief efforts of our chapters and alumni. APPNA has raised a total of $558,000 to date. There will be an APPNA telethon this Sunday on April 26 from 5 to 7 p.m. on TV1. Please join us in the holy month of Ramadan and give generously to COVID-19 relief efforts. Dr. Aisha Zafar, Chair Social Welfare Disaster Relief Committee, and Dr. Sajid Chaudhary, Chair COVID-19 Task Force, with the support of APPNA EC, continues to build our US and Pakistani initiatives. For Pakistan, APPNA has sent $95,000 for food rations, which are being distributed in all 4 provinces, not just in major cities, but also in remote areas and minority communities. Our partnering NGOs include Ahuat, Selani, Al-Khidmat, and Helping Hands. Alumni Association have partnered in this endeavor, including Khyber Alumni, King Edward Alumni, Jinnah Sindh Alumni, and Quaid-e-Azam Alumni. $20,000 worth of personal protective equipment has been distributed to hospitals across Pakistan, including Mayo Hospital, Sir Ganga Ram Hospital, Jinnah Hospital, Services Hospital, Lahore General Hospital, Punjab Institute of Cardiology, JPMC Karachi, Bolan Teaching Hospital, Gujranwala District Hospital, Skardu DHQ, Gilgit DHQ, Dera Ghazi Khan GHQ, and Mazang Hospital. Nishtar alumni sent $25,000 directly to Nishtar University to purchase PPEs locally. Quaid-e-Azam Medical College alumni sent $7,000 for PPEs for their alma mater. In US, APPNA has distributed food worth $62,000 through ICNA and local food pantries across the US. APPNA has been distributing thousands of N95 and KN95 masks, face shields, and protective gowns, especially in New York hospitals, worth $82,000. PPE shipments have been coming in batches, and APPNA has been distributing them as they arrive. APPNA merit webinars for Pakistan on management of COVID-19 patients. 24 days of daily live webinars, 90 minutes each, held at 11 p.m. US, 8 a.m. Pakistan time, has already been held by APPNA Merit since March 31st to enable real-time transfer of knowledge on this disease. The webinar brings together doctors in Pakistan and US to share best practices in taking care of COVID-19 patients. COVID-19 management is addressed from different specialties, including infectious disease, critical care, pulmonary medicine, cardiology, nephrology, GI, psychiatry, and many others. Faculty presenting in these are from Mayo Clinic, Harvard University, Northwestern University, Methodist Houston, Mount Sinai, New York, Seton Hall, New Jersey, Indus Hospital, AKU, and many other institutions. All webinars were recorded and are posted on www.appnamerit.com. APPNA doctors in US and Canada may also find them informative. Please publicize them to your doctor friends in Pakistan and US. For visa advocacy for incoming Pakistani residents in training, I was heartened to receive an email from an incoming resident last Sunday from Karachi, letting us know that almost all incoming residents have now received their required statement of need from Pakistan government after extensive APPNA advocacy. PMDC's legal issues had put residents in limbo for this essential paperwork. Our advocacy with Pakistan's Federal Health Minister, PM Health's Task Force Chair, and Pakistan Ambassador finally bore fruit. We have also been working with ECFMG and US Ambassador and Consular Section Head in Pakistan, as well as State Department Desk in Washington, D.C. to ensure that the 200 incoming Pakistani residents will be able to join their training on time. Now let me focus on APPNA chapters and alumni relief work with APPNA matching funds. APPNA chapters and alumni association have been active across US and Canada, raising funds and implementing their own COVID-19 relief projects with APPNA matching funds dollar to dollar for PPE and 50 cents for each dollar for food aid. APPNA is also helping purchase PPE at bulk rates and sending it to chapters who have already distributed 7,000 KN95 and N95 masks to 10 different hospitals and clinics across New York, Georgia, Minnesota, Oklahoma, Florida, and Texas. Chapters are working in their communities on many fronts. They're distributing food to the indigent, providing personal protective equipment to local hospitals, meals to first responders, staffing psychosocial hotlines, holding community awareness seminars, providing free COVID-19 testing, volunteering physicians to supplement staff in overwhelmed hospitals, contributing to Pakistan relief efforts, and fundraising for COVID-19 relief. Let me recount our chapter's efforts, starting with one of our Canadian chapters. Alberta, Canada, has raised over $13,000 for Pakistan relief efforts and Calgary Food Bank. Alabama raised $7,000 with APPNA match for PPEs in Alabama. Dallas KE doctors distributed 100 lunch boxes for Methodist Hospital staff this week. DMV held free COVID-19 testing clinics, donated $11,000 to local North Virginia food pantry. PPEs were ordered for local hospital worth $16,000. They donated $18,000 to US food pantries and $10,000 to Pakistan food rations. Georgia raised $10,000 for food packages for 500 families in Pakistan, 100 in every province including Gilgit. They provided 2,000 hot meals for local first responders and healthcare workers and masks for 10 Atlanta hospitals. Heartland, Kansas ordered 7,000 worth of PPEs with APPNA match for local hospitals. Minnesota, $9,000 for food with APPNA match. They ordered 2,095 masks for the local hospital. Dr. Nasser Qureshi, New Jersey, delivered 1,000 masks to Robert Wood Johnson Hospital System, 200 KN95 to Schneck Medical Center ER in Indiana. New York, COVID-19 helplines for New York City in Pakistani and Spanish-speaking communities in collaboration with APPNA Relief. They donated 5,000 to APPNA Relief for food distribution. They volunteered to distribute food to Pakistani communities, provided lunch and dinner to first responders in New York City ERs. They provided supplies and food for Pakistan. New England donated $2,000 to Worcester Islamic Center and Natick Food Pantry. They co-hosted webinars with Worcester Islamic Center on COVID-19 and have a mental health online platform. Ohio provided PPEs worth $7,000 to the local hospital. Oklahoma provided PPEs for $5,000 with APPNA match for Oklahoma provider. $7,000 with APPNA match was donated to local pantry. APPNA provided PPEs for $3,000 with APPNA match to local providers. $5,000 worth of food was provided to local families. South Florida provided $3,000 with APPNA match for PPEs to local hospital. They provided food to 500 families locally in South Florida. $1,000 was given to Islamic Foundation, South Florida Food Pantry, $1,000 to Islamic Center in South Florida. South Texas donated $4,000 to Pakistani Association of Greater Houston and $1,000 to Islamic Society of Greater Houston for food rations, $10,000 for Pakistani food rations. They provided PPEs to Harris County Hospital System with APPNA match. St. Louis raised $4,500 for PPEs and have an APPNA free clinics and have established a COVID-19 hotline. Wisconsin provided N95 surgical masks and gowns and face shields, as well as their children volunteered. They provided food to first responders in many different hospitals. Now an update on COVID-19 relief work on our Alumni Association. Camcana raised $62,000 for COVID-19 relief. In addition to KE alumni from Aga Khan, Allama Iqbal, KE alumni UK and friends donated. They worked hand in hand with APPNA to send PPEs to New York hospitals and Mayo Hospital Lahore and food rations to both US and Pakistan. Rawalpindi medical alumni have provided $8,000 worth of PPEs to Rawalpindi hospitals and $3,000 for food rations for indigents in Rawalpindi. Jinnah Sindh alumni provided $10,000 worth of PPE to JPMC Karachi in collaboration with Karachi-based Sindh medical alumni. They have worked closely with APPNA to provide another 1,000 N95 masks to JPMC, 1,000 N95 masks, and 1,000 face shield to New York Hospital. With 7,000 APPNA match, they have provided food to the different pantries in US. Camcana provided PPEs to Quaid-e-Azam Medical and $14,000 for food rations in Bahawalpur. Khyber provided food rations to 400 families in KPK worth $11,000 and meals to COVID patients in Peshawar Hospital. They are advising Pakistani government, KPK government and colleagues on the management of COVID-19 patients. They are also collecting funds, matching with APPNA match for their local hospitals in Maryland. I want to thank all my chapters and alumni for all the activism and relief work that they have done during this pandemic. This presentation is not an exhaustive list. Many chapters and societies are doing a lot more. We should be rightfully proud, and we should thank our donors generously for the hard work and the generous support. Wishing you a peaceful and spiritually nourishing Ramadan. Please be safe.